You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, cosmetic gum treatment. With us, we have an expert on the topic. She is a board-certified periodontist, Dr. Kania. Dr. Kania, welcome to the program.
Thank you. Thank you for having me.
Now, we've had you on the show before talking about lasers. You
Right.
use the lasers a lot. So for people that don't know you, who's your typical patient? Like, what are the types of things you do all day?
Great. Well, I'm thrilled to see people and save teeth. That's what I'm trying to do all day, is save teeth.
But as a periodontist, you're the gum specialist.
Right. We're trying to preserve, support, and replace it if needed. So we're trying to save teeth, and sometimes we have to place implants, take out teeth.
Okay.
So.
And I have a cousin, my first
Yes.
cousin,
Yes.
who has gum disease.
Right.
He was going to get surgery, and they also told him he was going to have to lose his teeth and probably headed for dentures.
Right.
And had him come out all the way from LA to see you.
Right. He's very
And
happy.
I could send him anywhere.
Well, he's a happy patient.
Yeah. So thanks a lot, by the way. And by the way, I should mention, people watching, it's a real interview. I'm not siding with Dr. Kania, but I did send my cousin to go see you, and he's thrilled.
Thank you.
And he says he could eat again.
Oh, that's
Teeth are
great.
strong.
That makes me happy.
So let's talk about your background too, because we're talking about cosmetic gum treatment, and the periodontist is the gum specialist.
Yes.
You went to Harvard.
Right.
Tell me a little bit about your training.
I went to UC San Francisco from dental school. That's my dental training.
Okay.
And then I did my residency at Harvard in periodontics, and I also did research there at Harvard.
So you did all your research?
Yeah, most of it at Harvard.
Okay, good. So your practice is in Encinitas?
Yes. And I have a private practice in Encinitas, and we're busy taking care of people and saving teeth.
What do you spend most of your time doing, by the way, of all the procedures you do?
Right. Well, I do a lot of lasers, LANAP. I do a lot of that. I also do place implants, take out teeth, place implants, and I do a lot of cosmetic gum grafts. That's kind of the three areas that I work in.
Now, when people want to save their teeth,
Yes.
you have a reputation, they need to go to you.
Nobody wants to save them more than me.
Are you serious?
I don't think anybody wants to save them more. I'm just passionate about it. So sometimes the patients don't want to as much as I do, but that's what I get up every day to do.
The truth be told, that people are told elsewhere those teeth have to be extracted,
Right.
and you save those teeth
We can do that.
using your laser, your
We can do
special
that.
laser. Is it a secret laser?
It's
Or
not a secret.
But it's a special laser.
Yeah, it is not a secret science, but we
Okay.
can do that. And I wanted to talk about this work because we talk about cosmetic gum grafts, but it's really about saving teeth as well. And we like to get to people earlier before we're at that place of, we have to lose teeth.
Okay, good. Okay, so we're talking about cosmetic gum treatment.
Right.
So what are if you had to categorize the type of cosmetic procedures, I realize a lot of them you say are in a lot of pain.
Sometimes,
cold
and
sensitivity.
sometimes if you look at kind of cosmetic procedures, sometimes there's too much gum, and we actually trim away gum.
Like a gummy smile.
Yes, they're born maybe with too much gum, or that's the way they've developed. So we trim that away. But what we're doing usually is exposing enamel. And if we expose root, they're going to have crowns or veneers or something. So that's to give them a more normal appearance. But sometimes they have lost tissue, lost bone and ligament and tissue, and we need to put that back. So we use grafts to do that.
Okay, now we talked in the last show about no more gum disease, no more bleeding
Okay.
gums,
Yeah.
bad breath. This is like, so no more receding gums. So
Right,
if
we
you have
wanna stop
receding
that
gums,
process.
what are the symptoms? Like, who should see you?
Well, people are often, they have cold sensitivity, and they've kind of learned to live with that. But if you're hesitating to have ice cream or frozen yogurt, or you don't want ice in your drink, then that's cold sensitivity. And those people should have an evaluation for sure. Because that usually means the roots are showing or the roots are exposed, and that means you've lost bone.
So when you drink
Yeah.
cold
Right.
fluid, and it hurts,
It's sensitive to
So
cold.
what's causing that?
Yeah, well, often the roots are showing. The roots are not supposed to be showing. They were not intended to be showing. You should have your enamel exposed in your mouth.
Okay.
So when roots are showing, they're more porous, and the nerve feels the cold. And it also means you've lost bone and ligament and gum. Your roots shouldn't be exposed.
So with so you've got receding
Yeah.
gums,
Yep.
and Could that also be an infection of some
It
sort?
can be an infection, which we want to rule out
Okay.
and treat. And also, it could be that you were born with thin, frail tissue, and you've lost attachment just from, brushing and eating and all the things that we do. You've lost that frail attachment, and you need to have that corrected.
So dentists all
And
over
we
San Diego County, by the way.
Yes.
I mean, they send you the tough cases.
Right.
Like what? Like what do they send you?
They send me patients that have root exposure, and
Okay.
we correct that problem so that the process doesn't continue, and they can save their teeth, and they can have ice cream, and they can, have a glass of wine. They don't have to drink red all the time.
Are there people that literally are that sensitive they can't even have?
They don't. They
cold
avoid
wine?
it. They avoid it, and sometimes they don't realize. Oh yeah, I avoid cold things. They've kind of. It's happened gradually, so they've gotten used to it, but it's a sign that you could have roots exposed. So we can correct that.
Now, something you told me in the green room
Mm-hmm.
before we started, you said that there are even some general dentists that really don't know at the level
Mm-hmm.
of cosmetic, of things you could do to the gums.
Right. There
Elaborate
are.
on that.
There are. Well, and there are some great dentists that do. And
Okay.
we work with a lot of wonderful dentists that do, and they send their patients to us before they do their veneers or crowns or bridges so that we bring the gum to the right level.
Okay.
Because the gums do frame the smile. And if you don't do that, your crowns, veneers are going to be too long. They'll look long, and that makes people look old as well. So we want to have a more normal anatomy to the gums and the teeth. They work together. So there are dentists that don't.
So you'd like to get more referrals?
I
from the
would
dentist?
like to help them know what we can do. And I want you to know there are some excellent dentists too that do refer to periodontists, and we just want to increase that education for them.
Okay, good. Now you brought some photos,
Yes.
and some of these are, I said, a little gruesome. 'Cause
Well,
we're not
to
used
you,
well, we're not used to looking
they're
at the inside of
beautiful
people.
to me. I love
they really
them. I have
beautiful to
no
you?
problem. I don't know what you're talking about.
Well, it's the inside of somebody's mouth. But I
Yeah.
have to admit, the gums do look good on the afters.
Yes.
So what are we looking at here? Wow.
Yes. So if you see the gum line, you can see that root has been exposed.
So at the top of the teeth, that's
Yeah,
what that
right
is?
at the top of the teeth by the gum, we have root showing, which shouldn't be showing. The patient's lost tissue and bone. So she had sensitivity to cold, avoiding cold things, ice cream, cold drinks, ice. And also it was difficult for her to clean her teeth because as the roots are exposed, they're more narrow.
Okay.
And it's difficult to clean. You end up actually abrading the gums as you're trying to clean. So before investing in new bridges and crowns, the dentist referred her so that we could correct that gum line, and then she would have a more natural, youthful smile.
All right.
And save her teeth because they were on the way to being lost from the bone loss. So what we did for her, we took tissue and transplanted it where she needed it, and we sculpted it where she was
She just put it
missing.
right there on the
Yeah,
gums.
it's a delicate procedure that we
Okay.
do. And then after it heals, you can see the after photo. It doesn't look like anything was done. It looks very natural.
Well, it's very clean.
Yes, it's clean and it's easy to take care of. And what I care about too is that the teeth are stronger and they're more supported, and we've stopped this process that leads to tooth loss. Now, I think the best part for her is that she now has smiled more. She smiles more. She just has more confidence, and she feels beautiful as she should.
All right.
She enjoys cold drinks and ice cream as she should in San Diego.
So how soon could this cold sensitivity go away?
Well, I've had patients where it goes away that day, where they're having ice cream and cold drinks that day.
And they tell you, they say, Dr. Kania?
Yeah, they have, and it's changed their life and opened up, their enjoyment of a lot of drinks and food. And then in some cases, it might take weeks.
But in less than a month, they'll be back
for
to
most
normal.
people. Yeah.
When things go well, less than a
Yeah.
month. Have you ever had a patient that suffered with this cold stuff for 5 or more years, and then it's...
Yes, absolutely. We have. I've had patients that for a long time, for many years, and now they're comfortable again. Okay, I wanted to bring something up about
Okay.
that patient that with the recessed gums and the exposed.
This last photo right here.
Right.
Okay.
So I want your viewers to know that this process will lead to tooth loss if you let it go. I've seen it happen too often where they just put up with it. If you have cold sensitivity, you're avoiding cold things, ice cream, it can be a situation where you will end up losing your teeth. If you have,
Why though? Why?
If you have roots showing, you've lost bone. Bone is what holds our teeth in our head, right? So if you've lost bone, the roots are starting to show, you can be on the road to losing the teeth. So
and people put it off though, obviously.
They do.
Because it doesn't show.
Right. Well, sometimes they learn to smile, you know, keeping their their teeth covered. And so they kind of have adapted, or they smile with their hands over their mouth. So it's not just cosmetic. I want people to save their teeth, and so that's why I want people to not be afraid to come and at least.
So how early should they go in? Just with a little bit of recession?
Yeah, I mean, they should come in and we'll see. I mean, we're not going to treat someone who doesn't need it. So if they need it, then we'll tell them what they need. And sometimes they don't need surgery. Sometimes they just need to change some habits, and we can help them stop the process.
You know, you told me in the green room, because you've been on my program before.
Yes.
And you said some people came in, they wanted the surgery, and you had to tell them all you need is a cleaning.
Yeah.
Is that right?
Yes.
That's good to hear.
Yes. Well, yeah. I'm happy they're coming. I don't mind seeing people earlier. It doesn't hurt anything to come in earlier and then have the good news that you don't need as much. So let's do that.
Okay, good. What else do you have here?
Well, I have so much. This is another patient with a similar kind of situation.
Wow.
Yeah. Randy, I want you and your viewers to look above the teeth at the gum line.
Okay.
And what you're looking at is root exposure. So if your viewers have root exposure at home, they'll notice that it's more yellow or it can be dark. That's the root that should not be exposed.
Do these people all need surgery?
No, they don't. We want to diagnose the problem and then treat them.
So there's other techniques.
Yeah, it depends on when we get them. You know, earlier better, right? The earlier the better. So,
okay.
Yeah.
See, because you're the specialist, right? I mean, as a periodontist. By the time they get to you, is this true?
Well,
sometimes
you know,
I
see more and more people now that are just coming in, you know, they hear something on a news program and they come in, so they're not even referred. A lot of them are not referred.
Because if you Google laser in San Diego, I mean, it's you.
Yeah.
I mean, it's true.
I think so.
I mean, you're wiping out gum disease.
I'm trying to, yes. It's my
How is
goal.
it, now this could be a bit controversial, but how is this problem of receding gums normally handled every single day in San Diego and across the country, because you don't like the way it's normally being handled?
Well, many times dentists who are trained to fill holes in teeth and fillings, they will put fillings in the roots because that's what they know how to do. And so they'll put fillings in. And I really want...
So like on that raised area, they put what, like a bonding, like a tooth
pretty
colored?
white filling in it. The problem is that doesn't correct the problem.
But doesn't it stop the sensitivity though?
It can reduce the sensitivity because you've covered the root. But the problem is that the tissue's irritated by a foreign material and the bacteria that accumulate at that foreign material, which is the filling. And so we just keep getting more and more recession, and the fillings get longer and longer until we lose the teeth.
Is that right? So that's being done every single day?
It is being done.
So rather than just taking gum from their mouth, like somewhere in the mouth, and just putting it and attaching it.
Right, which is that beautiful procedure that we do.
Yeah.
Sometimes the dentist will put a filling in the root. And there is a time for that, but we want to work with the dentist to see when that is.
But you don't like it?
Well, I don't want it done unless the tissue is in the right place, because the patient has lost attachment and the filling doesn't give them back attachment.
How are they presented? I mean, they're told you need a filling.
They're probably just told to put it. The patient doesn't even probably know where the filling's going. They just do what they're told to do.
Yeah.
But the dentist, a lot of my doctors are great and they refer to me and then we take care of the problem. But some doctors just don't even know. I think they're not taught about this problem. They're called mucogingival defects. That's basically gum problems in the mouth around the support of the tooth. And so the dentist just does what they know how to do, which is put fillings in. We're just trying to help.
And people need to know, they don't need a referral to go to you. I mean, they could go to the specialist first.
Right, many of my
And it doesn't cost more to go to the specialist.
I have no idea about that, Randy, but I'm sure.
It doesn't. No, but it doesn't. I mean, if you're doing the same procedure, you have more experience.
Right, well.
It shouldn't have to cost more to go to you.
Yeah, and I mean, this is my goal and my training is to support the teeth and save the teeth. And when they need a filling, then on the enamel of the tooth or something, then they need to see the dentist that does that.
Okay, good. Okay, if you're just tuning in, we're here with Dr. Kania, and we're talking about cosmetic gum surgery. If you have receding gums, if you drink things and it hurts, then there are some simple procedures, I guess, that can
yeah, we can correct
take care of that.
Right, we can correct that and save teeth.
And because I guess, and you give them medicines
right
after and
right.
even
Like
during the
anything,
procedure.
you know, you go to the doctor, you have something done, we give them medicine to help them, you know, get comfortable.
Seems really painful.
No, it's not. I have patients that keep coming back and having it done.
What do you mean they keep coming back and having it done?
They need more than one area treated, so they come back, they keep coming back. So if they keep coming back...
Well, so they may have like 8 teeth that need it done.
Right,
so
or
then they
areas.
have one, couple of teeth.
Yeah, and then when, you know, we'll get back to them and they keep coming. They don't like disappear. So they are okay. They're surviving.
So it's not that painful. Good.
Yeah.
Do some people say I should have done this years ago?
Yes, I have so many
Like what?
people that say that they wish I guess they were imagining it was awful, and they say, I wish I would have done this a long time ago. So, you know, we're like, yeah.
And you can make them look natural.
Yeah, well, yeah, that's the goal, is that everything's blending in. It doesn't look like anything. Matter of fact, we have to write letters to the doctors and the hygienists saying, we just did surgery because it looks so normal.
So they don't get too aggressive?
Yeah, because you have to give it a few months to mature a little bit.
And you can eat and chew and do whatever you want?
Right, after everything's healed.
But isn't it true, though, that your fancy laser
Yes.
can grow back some gum tissue as well? A little bit?
Well, the laser can definitely kill bacteria, disinfect the pocket. It can stimulate collagen, but it doesn't create a different type of tissue. Yeah,
okay.
A lot of our patients are actually missing keratinized tissue. They may have been born with mucosa and no keratinized tissue.
What does that mean?
Keratin is like in skin. It makes the tissue strong. Gum should have keratin in it. And mucosa, which is, if you think about it, the floor of the mouth,
Like
and
the shiny
cheeks,
lining in your mouth?
the cheeks, that's mucosa.
Okay.
There's not keratin in that. So sometimes patients have this mucosa all around the teeth, and it's movable and it's fragile. So the laser doesn't replace the tissue. But it is a great question, Randy. Thank you.
But if somebody just had like a little bit of recession to avoid like surgically removing tissue from another part of the
donor site?
Yeah. Do you have like synthetic material?
We have what we call biologic materials. We do have synthetics as well, but often we use biologics. So we have cadaver tissue, and we have we have growth factors.
Like, to me, I wouldn't worry about any of those things.
Yeah, I know. Some people do, some people don't.
I mean, because if it looks good and gets the job done.
Right. We have proteins from pigs that are expressed during tooth development that we can use. So we have a lot of biologic materials.
To avoid surgical procedure from another part of the mouth.
Well, sometimes we can avoid a donor, or sometimes we use it with the donor site as well to increase the area that we're treating. We can use biologic materials to help the outcome.
And the hot and cold, or the cold sensitivity can go away.
It can go away.
But for cosmetic dentistry, for people with gummy smiles, what are you doing there?
There, we're trimming tissue usually. If they have gummy smiles, we're removing some tissue that's kind of covering too much of the enamel. So that's, you know, if you're going to invest in veneers and crowns, you want the teeth to look normal when you smile. So that's an important thing to consider.
Now, when you were driving over here, and I know you knew you were going to be on the show, what was the main point you wanted people to know about cosmetic gum surgery?
I want them to feel comfortable to come in and see if this is something that they need. I don't want them to hesitate. Because we are saving teeth, we're helping the quality of people's lives, and sometimes helping them feel more confident and just smile again. I mean, it affects so much. It affects their social life and their professional life.
You told me somebody that they had receding gums, really bad receding gums. You did tell me this.
Yeah.
And after you fixed it, they ended up getting married and living this wonderful life.
I know, it did. It changed because she started smiling again. And you know what, I think that affects how you feel and how you carry yourself. So yeah, she's happy lady.
Did she give you some credit?
Well, yeah, she's still a patient of mine.
She said, thanks to you, Dr. Kania,
Yeah, that and a lot of other things. It started sparking other things for her.
Yeah, so
Yeah.
I guess if you smile more, you become more approachable.
Right.
A smile's
confident.
attractive.
It means a lot.
Who for sure needs to come in, like right away?
People with cold sensitivity, avoiding ice cream and ice cubes, and you know too when you're brushing your teeth that is not normal, because it shouldn't be uncomfortable to brush your teeth.
It even hurts when they brush their
Sometimes
teeth?
it does, yeah.
So it's less expensive the earlier you get in?
Yes.
'Cause, I mean,
and the outcome's more predictable too. You know, we want to have a good outcome. So don't wait.
Okay, good. You brought some more photos.
Yes.
We have time for probably
Let
one
me
more.
share with you this patient here.
All right. Oh boy.
Yeah. I want you to notice the gum line where the teeth meet the gum, especially on the upper arch. We did both a combination of trimming and grafts on that to give a more symmetrical contour for the patient, so that when they had their bridges and veneers and crowns placed, that they looked more normal and
So you
youthful.
just cleaned it up?
Yeah, and we did this combination of grafts, and because we cover the roots that are exposed, and we trim the gum that's covering too much of the tooth. So we did both for her.
Okay, good.
And had a nice outcome for her. You know, it made her much more youthful and, happy.
She was happy.
Happy.
Okay, good. What else? What else do you have?
Yes. Now I want you to notice too. This is at the gum level where the teeth are meeting the gum. She had cold sensitivity from the roots being exposed.
So that is the root.
Yeah, that's the root that you're looking at that's exposed.
Okay.
And I worked with her dentist so that we placed the gum where it needed to be, and then he changed the crowns and bridges so that they looked normal. They didn't look too long, which can happen if you don't correct the gum line. Then the crowns and the veneers are too long, and that makes people look older.
So
or
they look like
uneven.
big, giant. So whenever I see these huge veneers, chances
Yes.
are maybe they were covering up.
The root. Yeah, you wouldn't put them there.
Interesting.
You wouldn't put them there unless that's what the root's
So
exposed.
it's almost a shortcut if a cosmetic dentist just puts a big, giant veneer rather than bringing down the
Yeah,
gums.
it's not the-
Is that true?
Yes, it's not the ideal treatment, and I think it's a shame, because we want to have normal anatomy and normal contours of the teeth, and also as symmetrical as possible. So we want them to look, when we smile.
Well, you know what? And this is very interesting to me because when
Yes.
I see a lot of big veneers walking around
Yeah,
and long.
and it makes people look older.
It
It's
is
called
because
long in the tooth.
So it's not that they just had such big teeth; it's they were covering something up.
No, teeth are not unusually
Interesting.
long. There's a dimension of height and width that teeth have, and if you're seeing really long teeth,
Like
or
numbers,
if you
like
have
some sort of a formula.
yeah, there's a formula, and if
Secret formula?
it is a secret formula. You have to know the secret handshake, and you have to know the
Okay.
secret formula.
Right.
But if that's what's going on, is they're just trying to cover.
So it's a shortcut of a step.
It is.
Interesting.
Yeah, you didn't know that.
No, I didn't know. I never realized they were covering up with these big veneers.
You just thought they had really long teeth.
Some gum recession.
Yes.
Very interesting. And you don't like that.
Well, it's
Well, 'cause it
not the
doesn't look
right
good.
way. First of all, it's not the right way to treat somebody, but it also is not helping the problem that they've lost bone and they need to have attachment put back. So it's really not I'm concerned. I'm concerned that the attachment's going to continue to be lost and they're going to lose their teeth.
So when just so I understand you
Yes.
correctly, so when you just cover it up, like a dentist just puts filling material
Yeah.
on that recession,
Right.
may help with the hot and cold sensitivity, but it's going to just continue
Chances
recede and
are
recede?
it continues to recede. It's also harder to clean. It's hard for people to clean those long teeth. The brushes are not made for that type of problem. Another thing that I wanted to bring up with you with the roots being exposed is that they're more prone to decay. And roots are, they're more porous and they can decay.
Okay.
And so we want to prevent decay. Root decay is a big problem as our population ages. So we want to try to prevent that. So it's sensitivity, it's decay.
So you have to be careful brushing, not too hard up and down?
Right,
or
right.
more sideways?
We will go over that with our patients because every patient has
Can't
their
talk
own.
about it here?
Well, you can talk about it, but I don't want to give like blanket statements
Oh,
to
okay,
people
okay.
because Some patients don't brush well enough, and we need to get that brush on the teeth. Some patients
But
brush
not too hard up and down.
Yeah, and that's a problem. Some patients use too abrasive of, whatever they're finding in their cupboards.
I told you what I do. What do you think my problem is?
Right. Your problem.
No, I'm fine. I told it. Well, I brush up and down, but I'm very careful because I don't want to touch those gums.
Right. And so there's a balance, and that's
Because you've scared me.
well, we don't.
Because you only get one set of gums, right?
Yes, but there's a balance, and that's why we usually see our patients at cleanings and we give them feedback. We're like, oh, let's.
You like
try
Waterpik, right?
Waterpik's fine. Yeah. I'm not going to tell people usually to buy it, but if they have it,
Don't buy it.
I don't tell people they can use other things.
So flossing would be okay?
Flossing's great. Yeah. We want to floss correctly.
There's a right way to floss.
There's a wrong way and a right way.
What's the wrong way?
We don't want to create notches in the teeth. We don't want to, shred the floss on the roots. So we'll go over that with you when you come in.
You sure? Now, is it tape or you like the thin scrape?
This is also not an easy answer, Randy.
Are you kidding me?
No, I'm not.
So what is it
kidding
better
you.
than others?
Because
do I have to get a consult to find this out since you won't tell me on my show?
Because every patient has a different situation. Some people
Okay.
need tape because they have
Interesting.
wider spaces, and some people need glide or they need Teflon. So every patient has a different situation. There is not an easy answer.
Okay. But the main thing, and I think this is the takeaway.
It's custom planned for each patient.
Okay, but nobody should have cold sensitivity.
You should come on
You should
in.
be able to eat
You should be able to
sugar-free,
have ice cream.
frozen yogurt,
Go to Cold Stone, go to Swirls or wherever.
or whatever that stuff
Yeah.
is. So there's a lot of people that live this whole existence of,
And they're avoiding, yeah.
and they could get it taken care of in one afternoon.
Right.
Is that
you can
true?
Take care of it. Depends on your problem.
Okay. But some people, it just,
Some people.
Yeah, it takes one time sometimes.
It sometimes does. Yeah.
Okay, at least
Yeah.
go in, get evaluated.
Yes, we'll do the right thing for you.
All right. We're out of time. Always a
Yes.
pleasure to have it on the show.
It flies by with you.
I
Randy.
know it does.
Flies by.
Final message, somebody watching this.
Well, I want them to come in. I invite
If
them
you don't
to.
like your gums,
Well, yeah, or if
bleeding
you have
gums.
any concern about your gums or your teeth, please come in and we'll help you. We'll direct you where needed and
okay, good, good. Thank you so much. Always a pleasure. You've been watching The Wellness Hour. I'm Randy Alvarez. I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.